All right, well, good morning, and thank you all for joining me today. I'm going to start with having you introduce yourselves and tell me a little bit about your research project.
Well, I'll start by introducing myself and then I'll hand it off to Michelle. My name is Delengowski. I am the Director of Oncology Nursing Education at Thomas Jefferson University Hospital. I am the proud recipient of my second DAISY grant, the first of which we did as an inpatient looking at distress and distress related to induction therapy for leukemia. And it was a very successful project. And we now have our second, which I'll turn this over to Michelle to introduce herself and talk a little bit about our project.
So hi, I'm Michelle Lesota, and I'm one of the medical oncology nurses here at Jefferson. I'm also a certified hospice and palliative care nurse, and I second Ann in that I am super excited to have been a recipient of the DAISY grant to fund our research project, which is related to improving patients' experience during bone marrow biopsy and aspiration procedures. So at the time of my introduction to oncology nursing, I sat in on a bone marrow biopsy procedure, which I had never seen before. And so during that procedure, I sort of was a little surprised at my own response to watching the procedure and just sort of taking in the environment in the room from the time the patient and the family entered, watching their body language and sort of recognizing that, you know, anytime anybody gets a procedure, it's anxiety provoking, and this particular procedure, is usually being done for really big reasons, sometimes unknowns, and, related to diseases that are, really just very heavy things to process. And so as I looked around the room, I realized, we're in this sort of neutral kind of sterile hospital room. There's not really anything to sort of distract you away from your thoughts and what's happening in the room. And it's a knowingly painful procedure.
Yes.
And so this particular procedure is one that the patient will lay on their stomach. And so they're away from they're facing the opposite direction of where the procedure is taking place, which is behind them. It usually is a procedure that's done in the lower back around the hip area. And we have the ability to provide some topical numbing medication, but there's no way to actually numb the marrow cavity of where they're going to extract, a piece of bone. They're going to extract some marrow. And so in addition to having a procedure, we sort of also are taking away the visual of knowing what is happening during the procedure because it's all being done behind you. And so I just sort of took that all in as I looked around the room, and I just thought, wow, I think we can do this better. And so we started to do a little research on positive distraction therapies. And what was really important to me was that this was a non-pharmacologic study. It was not something we weren't going to be introducing more medications to a patient. And standard of care is not to have the patient be medicated in any other way other than that topical numbing medication.
Michelle, I want to bring up one subject here, though. I think for the people interested in applying for these the DAISY grant, is it came from Michelle to me as a simple question, like, could we do this better? What could we do? And we went from just a simple question from a staff nurse into this whole project that's now in its second phase. And I think really critical to this is DAISY supports that. DAISY supports the fact that we need to involve staff nurses because they're definitely at the grassroots level of what goes on every day. And so Michelle just came with a simple question and we went with it, and we had our first project done, and I'll let Michelle tell you about that. A very successful first part of this that actually won a national award and was presented at a national conference. And then we went to phase 2, and Michelle, this is where we applied for our DAISY grant.
Yeah, we certainly could never have moved forward with where we are now without DAISY, that's for sure. And so we had conducted a pilot study looking into distraction therapies. And so basically we asked patients who were having this procedure, if we could change something about this environment while you're having this procedure, would that be something that interests you? And if so, what do you think would help? How do you typically cope with stress? And we knew that this procedure causes distress, anxiety, pain. And so we were really looking at different methods to try to decrease the distress and the discomfort associated with the procedure. So we gave people the option of thinking about room environment changes or visual effects or, some type of wall scene, or the option for music or virtual reality. something that is a positive distraction to sort of take you away, take your mind away from the moment and the procedure itself and sort of get you through with being able to decrease all of the other stimuli. So patients did respond, some saying, if there's anything you can do to make this better, I'm willing to try it. I may not know exactly what that is, but if you come to me with an option, I'm all in. Some people said, yeah, I really love music. That would be great. I would love to listen to music in this room. Some people said, I would love to have something different to look at. And so it was really great. And we did a little more research. And so where we are now with our study is we've started phase 2. Thank you so much to Daisy, who has helped funded all of the things that we need to make this, just better for our patients. And it's been really exciting. So phase 1 right now, our patients are being randomized to either standard of care, which is a normal procedure, in comparison to having the option for a VR guided meditation. So they have goggles that they'll wear with the option to choose we have a variety of scenes that they can focus on: the beach, the mountains, the woods, different things. And that has a little bit of a meditative sound that we can add to that too. And then phase 2, we will have patients who are randomized to the standard of care procedure, or we're going to put up a wallscape in the room. So they'll be facing the image that's on the wall, and they'll have the option to choose the type of music that they want to listen to. And what I found in the research that I had done prior to the study was that there were research studies that were done other places around the world that did say that music and distraction was definitely yielded some positive results. But the difference in our study compared to theirs with the music piece is that the music in their studies was pre-selected for the patients. And in our study, the patients are going to be able to select their own music. And so it's really exciting. And we've enrolled our first 4 patients, I think, 3 patients.
Great.
And we had our first patient use the VR headset yesterday. And it was really exciting to watch.
Yeah. Well, I love, like you said, Anne, how this came from a simple question, and look what it's evolved into. And so I think you answered my second question of how did our funding impact your research project, right? You were able to go to a phase 2, correct?
Absolutely. Yep. Yes.
Wonderful.
Which involved the equipment, so we had to have funding for all that. The first one was kind of simple because there wasn't anything really involved. It was just pretty much a survey.
Right. And so how are you going to share and disseminate your findings? Because this sounds like many other facilities could benefit from a program like this.
So with our previous study, we reached out to a national cancer organization, and we presented at that level. And once again, it won an award, which was really kind of exciting. And it was really interesting because we took something that seemed like, I'm obviously been in this career for a really long time, and bone marrow biopsy's been part of my world for my entire career. And it took the insight from someone that saw it for the first time to make us realize the fact that this was really like invasive for the patient and really painful and stress related to it. So what our goal will be, and we will accomplish this, is to, once we're finished the study, is probably to either to the bone marrow transplant organizations or Oncology Nursing Society, present at that level. And then the next part would be to publish it. But I think we have a success in doing our first study, and I'm sure we'll have success with the second. And this one is so exciting because it's going to look at outcomes and interventions.
Right. Oh, can't wait.
If you don't mind me adding, I think this was so important to us from day one, but it became, it sort of elevated to a whole nother level during the pandemic. Because pre-pandemic, when we were sort of looking at this, patients were able to bring a family member into the room with them. And then all of a sudden we were in the midst of a pandemic, and patients were still having to get this procedure, in the same environment that I described prior, minus the ability to have their family there for support. And so it became even more important to figure out a way to make it more comfortable, make it feel safe, make it less, anxiety provoking, and less, uncomfortable to have that experience.
We actually completed the entire study during the pandemic, the first study.
Wow.
And it started this process, the second. And I also want to suggest the fact that the thing I love about Daisy Foundation is it includes staff nurses. Like it inspires me to be able to mentor others, because it's the next generation. And both the first study and the second study that we did, the impact on the staff nurse was phenomenal. And to be honest with you, I was the shadow, because they just took it and ran with it. And it was such a light in dark times sometimes for all of us. But so I really, really, really appreciate it.
And I love that too, because to be honest, from our standpoint years ago, we didn't realize that nurses did research. And that when you do research, you don't need $1 million because we thought, oh, we're not going to be able to do this. But oh, for the amount that you need and can make a significant impact, we can do that. And like you said, Anne, it encourages and inspires nurses who have never done research before to get involved. And that keeps it growing. And so I agree with you. I love that portion of this program is getting the staff nurses involved.
Again, our first study was inpatient, and I have to tell you that we had almost 100% participation from the staff when we did the first study. And the excitement on that unit by not only just the staff, but also the patients was phenomenal. And now we're into round 2, which is really exciting. We transitioned to the outpatient area.
Yes. And I was just going to add to what you were saying. I fall directly into that category because I have never participated in research before. And, you know, I have 20 years of nursing experience, and I can't even begin to tell you how exciting it is.
I can see the excitement for sure. I love it. Okay, so in hindsight, focusing on those who are going to be applying during the cycle or in the future, do you have any tips or advice for those who will be applying?
So I think critical to this is getting everyone's involvement and getting the right people at the table. We shared all the responsibilities of both the application for the grant and also IRB, going through IRB submission. So it was a shared joint effort. Everyone participated, and you know, it took a village, but we did it. And I think part of that is just seeing it come to fruition. We ran into a couple obstacles with this study only because of the pandemic, of trying to get the equipment, and it was on back order, and it was a little bit of a challenge. But you know what? We pulled through, and we got everything done. And this week was so exciting for us because we did get the first 3 patients on board. But yeah, so I think that it's just recruiting people that are going to work and expectations, because I think I had expectations that were truly met at beyond what my expectations were in terms of staff. So people do step up and people learn, and it really makes the profession even what it is today. And I think very exciting. And so again, can't thank you guys enough, because both studies couldn't have been done without it.
Oh,
absolutely.
Thank you, thank you, thank you. So in closing, is there any other information that you'd like to share about your project, or any other information about your DAISY grant experience?
Michelle?
I'm just thinking, you know, no question is a silly question. And I think, you know, if there's something that you just sort of feel inside, go with it. You know, this is sort of a slow and steady process, but it's, there's no value that you can place on the reward that comes with what we're doing. And so, you know, I think we're all in this to, you know, just give our patients the best experience that we can. And so I highly encourage everybody, you know, to just go with it, you know, absolutely go with it.
But I think in healthcare, and especially nursing, like, don't take the small stuff for granted. Like, once again, I did that for decades, looking at bone marrow biopsies, and what does it mean to quality of care to our patients? And the other thing is to just take a leap of faith. It's really not a hard process. The outcomes are phenomenal. It builds teams. It builds like satisfaction within nursing. So I think it really kind of checks off a lot of boxes in terms of what we're trying to do with nursing and for patient care.
Wonderful. Well, thank you both so much. I know you're busy.
Thank you.
Taking the time to tell us about your project and how much the grant meant to you. And like I said, we're going to share this with others that are applying as a really great resource. So I cannot thank you enough.
And we're like, if anyone wants to reach out to us, we have no problem with that too. Even having, you know, if a state running into obstacles, just call us, because we are so grateful to you guys for doing this for us. And so we want to give back, right, Michelle?
Absolutely. And it's been an honor to meet you and your family.
Yeah.
Thank you so much. You're doing really just amazing things. And I don't know, you know, I think sometimes you don't always get to know the ripple effect of what you sort of put out there, but it, you know, if we can give a little bit of it back to you today, just know that you're making a tremendous difference and that we could not have done this without you.
It made me feel really good that Patrick, like, maybe we're doing some good from what Patrick experienced too. So
absolutely, because he, like I said, he had 2 and they were very painful.
Yeah.
And like Michelle, having the wherewithal to look and say, I loved your quote before, I think we can do this better.
Yep.
And you're doing that. So I can't wait to see the outcomes, and perfect timing for this talk since you had your first 3 patients this week.
Yeah, it was very exciting.
Well, I look forward to seeing the outcomes. And again, I can't thank you all enough. And it was really nice talking with you this morning, and I'll let you get back to work.
Thank you.
Thank you so very much.
Okay. Thanks
Nice to
all.
meet you.
Have
Bye.
a great day.
You too.
Bye-bye.
Bye-bye.